Okay, so we're going to do range of motion of your upper cervical region. So we're going to do a chin tuck. So you're just going to bring your chin to your chest. So, yeah. Just like that. Okay. And then we're going to do extension. So you're going to come to forehead posture and look up as much as you can. Okay. Alright. Now, can you go ahead and lay your back down, please? We're going to do cervical flexion rotation. So I'm going to go ahead and bring the patient's head into flexion and just rotate it side to side, looking for any hyper or hypomobility, and if it brings on their headaches. Alright, so now I'm going to check her TMJ range of motion. I'm going to check her mouth opening. I'm going to do it twice, once for quantity and second for quality. So can you go ahead and open your mouth as wide open as you can? Okay, go ahead and close it. And I'll do it again, just for a measurement. Go ahead and open your mouth for me, all the way down, and back up. So I'm also checking for any abnormal movement as she's opening her mouth. If there's a deflection, you're going to see some abnormal movement going down, but it'll end up centered at the end. And for a deviation, as she's opening her mouth, it's going to end up on one side. Now I'm going to check her lateral deviation. Do it twice again for quantity and quality. So can you go ahead and move your jaw to one side? Okay, and the other side, please. Alright, now I'm going to go ahead and measure it. Okay, can you go ahead and move to the right? Alright, centered, and then go to the left, please. Okay, it's centered. And for mouth opening, normal range of motion is 40 to 50 millimeters, and for lateral deviation is about 8 to 10, but you're mainly focusing on symmetry. Okay, so now I'm going to do the resisted isometric testing for craniocervical region. So I'm just going to place my hand on different parts of her head. She's going to resist me pushing on her. Okay, so go ahead. Resist me pushing back. Okay, and then resist me pushing forward. Okay, and then for side bending. Okay, other side. Okay, and then for rotation. Alright, other side. Now for myotones, it's going to be the same exact hand placement for resisted isometric testing, but you're going to hold it for at least 5 seconds. Okay, so hold it. Alright, hold it. Hold. And hold on this side. Alright, and then for rotation, hold. Other side, hold. And all those were for C1, 2, and 3. For 4, can you go ahead and raise your shoulders up? We're going to hold that for 5 seconds at least. For 5, can you go ahead and put your arms out to the side and hold that?
Even more.
Okay, the same thing on this side. And for 6, we're going to look at elbow flexion and wrist extension. So can you go ahead and bend the elbow, and we'll hold it here. Same thing on this side. Okay, and then wrist extension. So can you go ahead, yep. Over here, same thing, hold it. For C7, we're going to look at elbow extension and wrist flexion. So can you go ahead and extend your arm, slightly bend it. Same thing on this side. Hold it. And then wrist flexion. So hold it there. Same thing over here. Hold it. And then for C8, you can test the thumb extension. So I'm going to go ahead and hold that. Same thing on this side. Go ahead. Resist here. And then for T1, I'm going to go ahead and place my fingers in between hers and ask her to squeeze and hold it for 5 seconds at least. Okay. For the cranial-cervical flexion test, I'm going to have my patient lying supine, and I'm going to place a pressure cuff underneath her, like the base of her head to the neck. And I'm going to have her do some chin tucks at different millimeters of mercury. So we're going to start out at 20. All right. And have her hold it there for 10 seconds. And then I'm going to ask her to tuck her chin a little bit more until she's up to 22 millimeters of mercury. And I'm going to have her hold it there for another 10 seconds. And then I'm going to move it up, tell her to tuck her chin a little bit more up to 24 millimeters of mercury. And then we're going to hold it there for 10 seconds. And then we move up to 26 millimeters of mercury. So have her tuck her chin a little bit more so she can hold it there for 10 seconds. And if the patient can hold it there at 26 for 10 seconds, that's considered normal. But you can keep going up to 30, so I'll move up to 28. So can you go ahead and tuck your toe a little more to 28 and hold it there. And then go ahead and push down a little bit more. Work your way up to 30 millimeters of mercury. Hold it there for 10 seconds. Okay, you can relax. Now throughout the test, I would be looking at her superficial neck muscles, make sure they're not popping out. For the deep neck flexor endurance test, I'm going to have my patient supine. I'm going to come in and have her relax her head, but I'm going to hold her head up about 1 inch off the table, and then I'm going to ask the patient to tuck their chin and have them hold their head above 1 inch off the table. So I'm going to release my hand and hold it there, okay? Alright. And while she's doing this, I'm just looking to see if she can hold it very well, if she's shaking, or if she's using any of her superficial neck muscles. And if we can hold it for at least 10 seconds, that's considered normal. So now we're going to look at the muscle length of different muscles in her neck. So we're going to look at upper traps first. And we're always going to assess both sides, but I'm just going to do one side for now. For her right upper trap, I'm going to have her flex the head, side bend away, but rotate towards. So look up. Okay? The head back to center. And for levator scap, we're going to go ahead and flex the head, side bend away, and rotate away. And then we're going to go back. And for SCM, we're going to go ahead and extend the neck, side bend away, and then rotate towards. Okay, center back. And for anterior scaling, we're going to have her rotate towards the side and extend back and away. That. And then for middle scaling, we're going to have her in neutral and just side bend away, back. And then for posterior scaling, we're going to have her rotate away and flex and back. So now I'm going to do an AA distraction. So I'm going to go ahead and feel for a C2 spinous process, and I'm going to stabilize that. I'm going to come in here and apply a distractive force at day 8. And for the anterior shear test, I'm going to go ahead and place my fingers underneath the posterior arch of C1. So I'm going to go ahead and find that first. And then I'm going to go ahead and apply an anterior force up. And we're going to hold that for 15 seconds. I'm going to have her keep her eyes open. And I'm going to be looking for any of those symptoms. And then slowly release the head down. And then for the AA transverse shear test, I'm going to use my thrusting knuckles. For my left hand, I'm going to place it on the transverse process of C1. My right hand is going to be on the transverse process of C2. And I'm just going to apply a transverse force here. And again, I'm going to have her keep her eyes open, and I'm just going to be looking for any of those reproduction symptoms. And then I'm going to have the patient sit up. Can you sit on this side, please? And we're going to do the alar ligament test. So we're going to do the alar ligament lateral flexion and rotation. So I'm going to place my fingertips on C2, spinous process of C2. And I'm going to grab hold of that. And then I'm going to go ahead and laterally flex. And I'm just moving her until I feel that C2 move. If it doesn't move, that means it's a positive test. And then I'm also looking for reproduction of symptoms. So I'm going to also, in the same position, rotate the head until I feel C2 move, or there's a reproduction of symptoms. And then for the sharp purser test, I'm going to go ahead and grab hold of that C2 spinous process. And I'm just going to apply a force with this hand here. And I'm just looking for any hypermobility going on there and reproduction of symptoms. For the brachial plexus compression test, I'm going to go ahead behind the patient. I'm going to palpate for the architrap and then the FCM, and I'm going to go between that and apply some pressure. I'm also going to push posteriorly to the clavicle or anteriorly to the clavicle. And this would be positive if it reproduces their symptoms of radiating pain on the arm. For the distraction test, we go ahead behind the patient, have them lean on me and relax, and I'm going to hold underneath their occiput here and distract upwards like this. And this test would be positive if their symptoms were relieved. For the Sperling compression test, I'm going to have the patient sit here. First, I'm going to apply pressure down on their head like this. And then I'm going to have them slightly laterally flex and do it on this side. And then I'm going to do the same thing on the other side. And this would be positive if it reproduces that radiating pain down the arms. For the Jackson's compression test, I would also start out with the patient's head in neutral, apply a force down. But then for Jackson's, you're going to go ahead and rotate the head and apply the force down on their head. And then rotate to the other side and do the same thing. And again, this test will be positive if it reproduces their symptoms of radiating pain on the arm. For the shoulder abduction relief test, we're going to go ahead and have the patient put their arm over their head like this and relax. And again, this test would be positive if their symptoms were relieved. And this is typically for C4 or C5 nerve roots. For the upper limb tension test for the median nerve, I'm going to go ahead and depress the shoulder, abduct the shoulder to about 110, have the forearm supinated, going to extend the wrist and the fingers, and then we're going to go ahead and extend that elbow. And we're going to do it slowly, and we're going to stop right there. that's bringing on her pain. You can also laterally flex the head away. For the radial nerve, we're going to go ahead and depress the shoulder. And we're only going to do about like 10 degrees of shoulder abduction. We're going to pronate the forearm, and we're going to flex the wrist and fingers. And then we're going to go ahead and slowly extend that elbow. And then you can go ahead and have the patient laterally flex their head away from the side to see if that brings on their symptoms. For the ulnar nerve, we're going to go ahead and depress that shoulder, abduct to about 110 degrees. And we're going to pronate the forearm. We're going to flex the wrist. Extend the wrist and extend the fingers. And then we're going to go ahead and flex that elbow until that brings on their symptoms, or you can also laterally flex the head away from that side. Next, we're going to do upper motor neuron lesion testing, the Lermite sign. So we're going to have the patient long sit. We're going to have her slouch forward, flex her head, and then I'm going to go ahead and passively raise her leg. And what I'm looking for here is kind of like a zap going down her back or her leg. Okay, now we're going to do the Hotton test. So I'm going to have the patient sitting, have her extend her arms out, palms up, and have her close her eyes. And we're going to hold this position for about 10 to 30 seconds. And I'm just observing her arm movements to make sure they're not swaying too much. And then after about 30 seconds, you can tell her to relax. Open up your eyes, and if you did see any exaggerated arm movements, that would be positive for a non-vascular test. And then you can go ahead and extend your arms out again, palms up, but this time we're going to go ahead and extend, rotate, side bend the head, and have her close her eyes. And again, hold this for about 10 to 30 seconds, and observing the arms, make sure they're not moving too much. And then after about that time, you can go ahead and have her relax. Now if her arms were moving a lot during that test, that would be indicative of a vascular issue. For the vertebral artery quadrant test, I'm going to have my patient sit here, and I'm just going to walk behind them, and I'm going to have them look towards me. So can you look over your right shoulder? Make sure they're extending their neck, rotating to that side. And we're going to hold this here for a few seconds, and I'm just going to make sure I'm looking at her eyes. And I'm going to do the same thing on the other side. So can you go ahead and look back at me, extend that head, rotate that head towards me. And again, I'm observing her eyes. And this test would be positive if you see any of the 5 Ds. So now we're going to go ahead and assess her first rib mobility. So I'm going to have her lying down supine first, and I'm going to go ahead and palpate for that first rib. And for here, I'm going to go ahead and ask her to take a deep breath in and out. And we're just looking at symmetry and making sure if there's, or just checking if there's any hyper or hypomobility. And then I'm going to go ahead and ask her to side bend her head. Can you go ahead to your right side? And then go to your left. And same thing, looking for symmetry and hyper or hypomobility. Okay, can you go ahead and lay on your stomach for me? And from here, we're going to go ahead and palpate for that first rib. And I'm just going to go ahead and provide a caudal glide. And again, we're assessing for symmetry and any hyper or hypomobility. For the Adson's vascular test, I'm going to go ahead and palpate for the patient's radial pulse. And then I'm going to bring her arm into extension, external rotation, and abduction. And then I'm going to have her rotate her head towards me. And take a deep breath in and have her hold that for about 60 seconds. And I'm feeling for the pulse to make sure it doesn't diminish or go away at all. and relax. For the costoclavicular test, I'm going to go ahead and feel for that radial pulse again. And then bring her arm into more extension, external rotation, and abduction. And again, we're just going to feel for that radial pulse, see if it diminishes at all. For the roost test, we're going to have the patient bring their arms up like this, and they're going to slowly open and close their hand for about 3 minutes. And what I'm looking for here is symmetry between the hands. Make sure they're opening and closing at the same time. Also, it would be positive if the patient complains of any like numbness or heaviness in the arms and hands. Okay, and for the right test, we're going to go ahead and feel for that radial pulse. And we're going to bring our arm into external rotation and elevate to 180 degrees if possible. And again, we're going to hold this and feel for that pulse. It'd be positive if it diminishes at all. For the shoulder girdle passive elevation, we're going to go ahead and have the patient, can you cross your arms across your chest like that? I'm going to go in behind. And I'm just going to elevate her shoulders here. And this would be positive if her symptoms were relieved at all. If it was neuro pain, it would change from numbness to paresthesia. But if it was vascular, you would there'd be like a stronger pulse, or her hands would become warmer. Okay. So now we're going to test reflexes. We're going to do brachioradialis first. So I'm going to palpate for it here. And then we're going to go ahead up to the biceps. Relax. Now we're going to move on to the triceps here. And relax. And now we're going to move on to the jaw jerk reflex. I'm going to place my thumb over here. There we go. Alright, so for palpation of the different masticatory muscles, for temporalis, you're going to go above the zygomatic arch up to the temporal region, and you're going to ask them to go ahead and bite down. And you should feel it pop out right there, and you're looking for symmetry. For the masseter, you're going to go down to the angle or the ramus, and palpate right above that, and ask them to bite down again. And you're going to feel that pop out right there. For the medial pterygoid, you're going to go ahead and palpate along the inner aspect of the lower teeth. And for the lateral pterygoid, you're going to go on the outer aspect of the upper teeth. So now we're just going to go over resting position of the tongue. Essentially, you want the patient to have their tongue resting on the roof of their mouth, feeling the ridges, almost like they're about to say the word no or about to cluck. And when they do that, their mouth should slightly open, and you're making sure that their back teeth are not touching.